Welcome to another episode of Healing Horizons. Today we have the privilege of speaking with a distinguished expert in ibogaine therapy, someone whose dedication and knowledge in the field are truly unmatched. Thank you for joining us.
Thank you, Chris. I'm delighted to be here and excited to delve into this important topic.
To kick things off, let's talk about alcoholism as a chronic condition. It affects so many, both the individuals directly and their families. Could you expand on its impact and why it's crucial to explore alternative treatments like ibogaine therapy?
Absolutely, Chris. Alcoholism is indeed a pervasive issue that can lead to devastating consequences for the person afflicted, as well as their loved ones. It affects one's physical health, mental well-being, relationships, and even economic status. Chronic alcohol consumption can lead to liver disease, pancreatitis, various cancers, and much more. Families often struggle as well, dealing with emotional stress, financial burden, and sometimes broken relationships. Traditional treatments like counseling and medication can be effective, but they don't always work for everyone. This is where alternative therapies like ibogaine come into play, offering new hope for recovery.
The scope of the problem is indeed vast, and the need for solutions urgent. So let's dive into ibogaine therapy. Could you share a bit about its origins and how it's been traditionally used?
Ibogaine is derived from the root bark of the Tabernanthe iboga plant, native to Central Africa. Traditionally, it has been used in Bwiti spiritual practices and initiation ceremonies as a powerful psychoactive substance. The Bwiti religion is centered around personal enlightenment and healing, and ibogaine plays a crucial role in facilitating profound introspection and spiritual revelation. In the 1960s, ibogaine was discovered to have anti-addictive properties, leading to its present-day application in treating addiction to various substances, including alcohol. This naturally led researchers and practitioners to explore its wider therapeutic potential beyond traditional uses.
It's fascinating how ibogaine's use has evolved from traditional contexts to modern therapeutic applications. Let's talk about the science. How does ibogaine interact with brain chemistry to aid in addiction treatment?
Ibogaine acts primarily on the brain's neurotransmitter systems. It has a profound effect on the dopamine system, which is crucial in the development of addiction. By resetting the neural pathways related to addictive behavior, ibogaine reduces cravings and withdrawal symptoms. It also interacts with the serotonin and NMDA receptors, contributing to its psychoactive effects, allowing for deep psychological introspection. This comprehensive neural reset helps disrupt the cycle of addiction, giving patients a window of opportunity to adopt healthier behaviors and mindsets.
The neural reset you mentioned sounds pivotal in altering addiction pathways. I'm curious to hear about personal experiences. Can you share some accounts from those who've undergone ibogaine therapy for alcohol dependency?
Certainly. Many individuals report experiencing profound shifts in their perceptions and emotional states after ibogaine therapy. For example, one patient described the experience as a life review, where they could see the consequences of their alcoholism laid out clearly. This allowed them to confront the underlying issues contributing to their addiction. Such insights, coupled with the reduction in cravings, bolster their resolve to maintain sobriety. Another individual spoke of how ibogaine helped them reconnect with their sense of purpose and self-worth, which had been eroded by years of alcohol abuse. These transformative experiences are not uncommon and illustrate the potential of ibogaine to catalyze deep-seated change.
Those stories are truly inspirational. It seems the therapeutic process encompasses both scientific and spiritual components. Could you expand on the role of spirituality and personal insight in the healing process?
Spirituality is indeed a significant aspect of ibogaine therapy for many. During the treatment, patients often encounter visionary experiences that foster deep personal insights. These experiences can serve as a catalyst for spiritual awakening or reconnection. For some, this means an enhanced sense of interconnectedness or a newfound clarity in their life direction. This spiritual dimension complements the physical and psychological reset, creating a holistic transformation that traditional treatments might not fully address. The pursuit of meaning and the development of a personal, spiritual framework can provide ongoing motivation for individuals as they continue their recovery journey.
It's compelling to see how spirituality and science can work hand in hand. How does ibogaine therapy compare with traditional alcoholism treatment methods?
Traditional treatments often focus on behavioral therapy, counseling, and medications that mitigate withdrawal symptoms or cravings. While these can be effective, they sometimes fall short in addressing the deeper psychological and existential issues many face. Ibogaine therapy, on the other hand, provides a more immersive approach that targets the root of addiction, both neurologically and spiritually. Patients often report a more thorough and immediate disruption of the addiction cycle post-Ibogaine treatment, which can be a game changer for those resistant to traditional methods. That said, it is crucial to recognize that Ibogaine may not be suitable for everyone, making it more of a complementary option rather than a replacement.
So we're looking at a complementary approach rather than a wholesale replacement, which makes sense. What about the potential risks and benefits associated with Ibogaine therapy?
Every treatment carries potential risks, and Ibogaine is no exception. Physically, it can cause changes in heart rate and blood pressure, which is why a thorough medical evaluation is necessary prior to treatment. Psychologically, the intense nature of the experience can be overwhelming if not properly prepared for. However, the benefits can be significant. Many patients experience a substantial reduction in withdrawal symptoms and cravings, as well as profound personal insights. These benefits can vastly improve long-term recovery outcomes. It's essential, however, for individuals to undergo therapy in a controlled, medically supervised environment to mitigate risks and maximize benefits.
That emphasis on safety is reassuring. What are your thoughts on the future of alternative therapies for addiction recovery, particularly regarding Ibogaine?
Looking to the future, I believe that alternative therapies, including Ibogaine, will continue to gain traction as part of integrated treatment plans. There is growing recognition of the need for personalized and holistic approaches within mental health and addiction treatment. As scientific research advances and more data becomes available, we can expect a refinement of protocols and increased adoption of these therapies. Ultimately, the goal is to offer individuals options and hope, paving the way for innovative solutions to complex health challenges like addiction.
We're at a very promising juncture for addiction therapy, it seems. For those interested in exploring Ibogaine therapy in Mexico, are there resources you would recommend?
Yes, certainly. It's important for individuals to conduct thorough research and seek out reputable treatment centers. There are various clinics in Mexico that specialize in Ibogaine therapy and adhere to high standards of medical and ethical practice. Organizations such as ICEERS or the Global Ibogaine Therapy Alliance provide valuable information and resources for those seeking treatment. Additionally, engaging with communities, both online and in person, can offer support and insights from individuals who have undergone similar journeys.
Thank you for those resources. As we close, what message do you have for listeners who might be considering this path, either for themselves or a loved one?
I would encourage listeners to explore all available options and approach their journey with an open mind. Recovery is deeply personal, and what works for one person may not work for another. However, the presence of hope and the pursuit of healing are universal constants. Take the time to understand the therapy fully and seek guidance from professionals and support networks. You're not alone in this journey, and making informed choices will set the foundation for meaningful recovery.
That's a wonderfully supportive message to end on. Thank you so much for sharing your expertise and insights with us today. It's been an enlightening conversation. To our listeners, thank you for joining us on this episode of Healing Horizons. We've explored the transformative potential of Ibogaine therapy in addressing alcoholism, delved into its scientific and spiritual dimensions, and heard moving personal stories of recovery. Remember, this podcast is about providing a beacon of hope and a springboard to more informed choices on the road to recovery. Until next time, take care and stay compassionate.